Knock, knock, knock. Hello, my name is Caitlin, and I will be your student nurse for today. Today we will be performing a newborn assessment on a 3-day-old baby that was birthed vaginally with no complications, forceps, and not a long birth. The first thing we're going to do are the vital signs, which are temperature, pulse, and respirations. Temperature is usually done auxiliary, and that ranges from 97.7 to 99.5. Pulse is done with a stethoscope. It cannot be taken how you do in adults, and it has to be done on the apical or apical pulse and assessed for 1 full minute, and those are usually 120 to 160. And then the last thing that we're going to do are respirations, and respirations usually range from 30 to 60. You're going to keep your hand here for 1 full minute and count the rise and fall of the chest. The next thing we're going to move on to are head and chest circumference and length and weight. So head is done at the brow and all the way around. Chest is done at the nipple line and all the way around. Length is done tip of toe to top of head. It's usually 19 to 21 inches. And weight is done on a scale, and that usually is 5 pounds, 8 ounces to 8 pounds and 15 ounces. Now we're going to move on to the general appearance. Baby seems happy, healthy, no labored breathing. Now we're going to do body alignment, symmetry, muscle tone, and cry. So all body parts are present and can move symmetrical. They are aligned, and muscle tone is present, usually flexed. And the cry, baby's not crying now, but the cry should be lusty and strong. For the skin, we're going to be looking for vernix, which is a cheesy white substance that you can find in the crevices, wrinkles of the skin, or in the neck. Milia, which are little white bumps across the nose. Lanugo, which is hair that's found on the baby at birth on the arms and back. Erythium toxicum, which are little red blotches on the baby that are, irregular. And then we're going to be looking for Mongolian spots, which resemble bruises. So you need to document that to be sure that no one else gets confused from a Mongolian spot and a bruise. And then we're going to be looking for pichke, which are little red bumps on the baby's face. Now we're going to move on to the head. So I would say the head is round and symmetrical, normal cephalic. We're going to be assessing the fontanelles, the posterior, which is a triangular shape, and the anterior, which is a diamond shape and found on the front. We're going to be assessing those fontanelles to see if they're bulging or sunken in. We're also going to be assessing for strabismus, we're also going to be assessing strabismus is the eyes, and conjunctiva or conjunctivitis. None of those are present, by the way, but I'll get to that. But we're going to be searching for molding, kaput. Those are both normal. Molding is basically when everything comes together to fit out of the vagina. Kaput is generalized edema or swelling of the head, and cephalohematoma, which is a deeper layer of trauma from birth and can form blood clots. The next thing we're going to do is face and eye. Now we're getting there. So no conjunctivitis is present. No strabismus is present. The outer canthus of the eye lines up with the ear. The face is symmetrical. The eye color is slate gray, and pupils are round and reactive to light. The next thing we're going to be moving on to are the ears and nose. So as I stated before, the outer canthus lines up with the ear. There are no signs of dimpling or tagging. For the nose, nasal passageways are open and patent, and there is airflow can get in and out because this is the baby's normal route of breathing, is the nose right here. For the mouth, we are going to assess for Epstein pearls, precocious teeth, and we're going to document if we find them. we are going to use a gloved finger and assess for the soft palate and the hard palate. And we're going to make sure that they are intact and there are no openings, which they are intact and no openings. And while you're assessing the mouth, you can also assess the reflexes, sucking, swallowing, and rooting, or you can assess those while the mother is breastfeeding. They are all present. Sorry, it was a gnat. The next thing that I'm gonna move on to is the neck and the clavicles. So clavicles are intact and not broken. And now we're gonna move on to the chest. So chest is symmetrical and rises and falls equal bilaterally. Nipple size are within defined, like they're within alignment and correct size. There's no engorgement from the mother's hormones. What else? Nipples. Breast buds, we're going to assess for those, which are usually 2 to 5 millimeters. And then we're also going to listen to chest sounds and see if there's any abnormalities or murmurs. None of those are present. And we're going to do the apical for 1 full minute to assess those and listen with the stethoscope. The next thing that we're going to move on to is the abdomen. So abdomen is symmetrical and not distended. Breath sounds, you're going to listen to those again with the stethoscope. They are going to be present. You're going to check that voiding patterns are normal. You can either ask the mom or check I's and O's. Along with the abdomen, we're also going to assess the... oh my goodness. We're also going to assess that the umbilical cord is dry and intact and that there is no signs of infection. Okay, so next we're going to move on to genitalia. We are going to assess for a female the labia minora and the labia majora. We're going to assess, see if there's any drainage. There's no signs of drainage on this baby. We're going to make sure that the labia majora is covering mostly everything of the baby's private parts. For a male, we're going to make sure that the meatus is located centrally to urinate on the end of the penis. We are going to palpate the scrotum. We're going to make sure that the testes are within the scrotal sac and that rugae is present. So then we're going to move on to extremities. So all extremities are present and move equal bilateral. Muscle tone is also present and range of motion is good. We're going to do the Ortolani hip test, and that we're going to move the baby's leg up and out, and we're going to assess if there's any popping or cracking, because that can mean that there's hip dislocation. No popping or cracking here. We are also going to assess to make sure that the baby has all fingers and toes, which they are present, and we're going to make sure that there is no clubbing of the feet. The next thing that we are going to do is reflexes. So we're going to do Moro, lift baby up, or no. The next thing that we're going to do is the spine, the back and spine. We're going to flip the baby over. We're going to assess the vertebrae, make sure that there is no openings present and that the vertebrae is within alignment, and it is. We're also going to assess for anal patency and make sure that the anus is patent, which it is. And while I have the baby like this, we're also going to assess for spina bifida, so which is not present in this baby. So baby is good. And while I have the baby like this, I'm also going to do the reflex incurvation, trunk incurvation, which is basically whichever way you do your finger, the baby will turn on the side of the baby. So if I do it like this, baby will turn this way. If I do it like this, baby will turn this way. Okay? And now we're gonna go on to the rest of the reflexes. So, like I said before, Moro, we're gonna lift baby up, act like we're gonna drop them, but we're not, and the baby will make like a startle reaction. Present. Trunk incurvations also present. Next, we're gonna do tonic, which is whichever way the baby's head is facing. The arm that the head is facing will stretch out, and the opposite arm will go up like this. So it's like a fencing thing, and that is whichever way the baby's head is facing. So if it goes this way, same thing, out in like fencing, which that is present. Next, we're gonna move on to plantar and palmar. Plantar, I'm gonna put my finger in the baby's hand. It's gonna give it a nice squeeze. I'm gonna put my finger on the baby's foot, and it should give it a nice, like, same reaction. Next, we're gonna move on to stepping, which is if you pick the baby up, they will make a little stepping motion. Next is gonna be Babinski reflex. We're gonna go with our finger up and out. Baby's toes should flare, and that is a positive reflex. The other reflexes that I stated earlier, sucking, swallowing, rooting, all present. All of the reflexes I just tested are present. And as I said before, you can also check rooting, swallowing, and sucking with mother doing breastfeeding. And for the behavioral state of baby, I would say that it's in a quiet sleep, which is when they can fuss or, give little cries, make little faces, maybe move an extremity or so. And they can be easily aroused, like with loud disturbances, but you can also soothe them back to sleep if necessary. I also want to put my attestation form here. And I also want to state that I know in real life the baby would normally be, with no clothes on, with a diaper on, but this baby is sewed up in the back. So I physically cannot take this outfit off. And I believe that's it. Thank you.